but certainly that formality remains for the very serious incidents, and we've full trust in our services and staff that they can make an appropriate judgment call on that. It's really important around our documentation, and certainly all our legislation emphasises the need for documentation, and it's really important for that written follow-up. And all of you will know at this stage that the written follow-up should be a compassionate letter with summary points captured at minimum. So some people in the more serious instances might still do minutes. That's for services to determine with the patient and the family, but at minimum there should be a letter that follows. And we know that after the open disclosure initial meeting where we acknowledge the incident, apologise for the incident and explain that it'll be reviewed and followed up, there might be additional meetings after that. And for the purpose of the process, we say that the open disclosure process is closed for those types of incidents when the review findings are shared. And for category 3 incidents, if they're in effect closed, if somebody speaks to somebody, and you'll know from our policy for the category 3 incidents, it's discretionary. So we do put emphasis on promoting good and open and transparent conversations when a patient is involved. So if a patient got the wrong medicine, for example, but there was no harm, that we're still open and transparent then. But we're not labouring it for every near miss incident and so forth, because that would be very impractical. Okay, so there are steps. So for the purpose of the measurement for open disclosure, I'm going to talk to the 3 key steps. Now, I'm assuming that all of you on the call today do have login rights to the NIMS system. If you're relatively new and this is a new part of your role, that you might be doing the oversight for your organization or pulling reports or anything like that, and the ask is that you provide some data from NIMS, do contact us at nims@hse.ie, and there is a kind of access request process that needs to be approved within your organization and then goes over to our team to process. So it might be that you're working in your current location and you're asked about a particular incident, or somebody senior says, can you just check on a particular incident? And in its very simplest form, you can log into the NIMS system. You access the Incident Manager app launcher. So when you log on, it gives you an option. There are a number of different apps depending on your access rights that you may access. And for our purposes, it's the Incident Manager one that's really important. And then you might have your specific NIMS reference number. You type that into one of the search fields and you can find that particular incident on your records. Oh, apologies. So these are the key open disclosure fields that we added to NIMS. So this coincided with the Patient Safety Act going live last year on the 26th of September. They highlight or they capture 3 key steps. These fields are particularly important for any category 2 incidents, category 1 incidents, and notifiable incidents. So these 3 steps should be followed, and acknowledging that there might be various levels of engagement depending on the seriousness. But in all instances, there should be an open disclosure meeting or conversation whereby we acknowledge that there was a patient safety incident, that we apologise for it and explain what's going to happen, be it in that care and with regards to the review process. So has that conversation/meeting taken place? Yes or no? That should be followed up in writing. So that's the letter that we spoke of. Has a letter been sent? And lastly, has a review report been shared? So they're the 3 kind of key measurable ones. So if you're pulling reports and you want to track where you're at with your different incidents, you can see where the gaps are. For anybody working in NIMS in particular, there are 2 scenarios where open disclosure might not be possible, and they're for very good reason. So it might be that we can't actually find the person we want to do open disclosure with. So if somebody, certainly it's happened to me in my QPS role, we couldn't find what we called in those days the next of kin to do open disclosure for a person that was deceased, even though we tried very hard, contacted GPs and that. So it might not be possible to do open disclosure because we can't find the person that we're meant to do open disclosure with. I'm just going to click on this. Apologies, because I'm just logged in and I don't want to get kicked out. And the other reason why we might not be able to do open disclosure is if the patient or their family decline it initially. So obviously, in some scenarios in particular, it can be quite traumatic, and they'll have other priorities, and they might not want to do open disclosure at that time. And obviously, the offer to them should be that they can re-engage with us at a later date. And sometimes some people just aren't, don't want to pursue it full stop. So there is an option there to highlight if any of those exemptions apply, and that's very reasonable, so shouldn't be seen as a negative when you're doing any kind of reports or anything like that. And then our staff can also log whether or not it's deemed to be a notifiable incident and the type of notifiable incident. Now there's a whole separate form that then it needs to be completed by a service and their particular staff within a service. Generally, maybe QPS people or senior managers who complete that form and that notification to the relevant regulator. I'm not going to go into that for today's purposes, but we have other recordings and webinars, apologies, where we have outlined how that process follows. So one of the things to highlight, you'll see that on this slide, the first field is already populated with yes and a date is added. So our staff who initially report the incident can highlight whether or not they've done open disclosure. So at the time of completing the paper form, or if they use EPOE, they can say, yes, don't know. There might be somebody else who's not directly involved reporting the incident, or no. The important piece for people who are managing incidents is to have that assurance that that was actually open disclosure. So some of the feedback we get from patients, some of our research shows that actually people might have had clinical conversations or just conversations about an event, but it wasn't explained to them that it was a patient safety incident. They might not have captured an apology. So this, yes, is really that measurement piece to say, they had that open disclosure conversation. Okay. So they are just the key fields that we use for reporting purposes and for some of our national reporting as well. So since June of this year, some of you will know that, well, hopefully all of you will know, is that we built some global views. And I will show you what that means in a minute. So a global view is already a kind of a predetermined search criteria where our staff can, from a whole different range of drop-down headings in this field on the Incident Manager app, choose a particular report and it will bring you, it will give you that data relevant to your access. So if you have access rights for a whole hospital, and you might want to see all the incidents where open disclosure took place, you can just click on this field and it will auto-populate, and you can extract those incidents and have a review of those. I'll show you all the different global views that we created, but that's the language that we use. It's a global view. The reason it's global is because everybody in the organization can pick one of those predetermined search criteria and reports. There is also the dashboard function. So I focused in on the Incident Manager app initially. That's an option that you can click into and look at the different incidents. There's also another app called a dashboard. So when you click into the dashboard, you can choose all the open disclosure search terms, and it will give you them all the different headers on one page. Now we are working, and we have requested it from the State Claims Agency that they maybe make that a bit more interactive with some nice graphs and things like that. So you could pull reports just from the dashboard functionality for your reporting purposes, if you're producing reports for your governance meetings and so forth. So these are all the global views that we created. So it's all incidents where open disclosure took place. The reason we have it from this timeline is because the functionality only exists from this timeline. So some people might backdate some of their incidents, but we're certainly not asking people to do that. So the understanding from our office is that that functionality only existed after that date. So there is, you might want to do it, but there's no requirement from us that you backdate any of the other incidents. All incidents where open disclosure process is closed. So it's where that field, certainly for category 1 and category 2, and notifiable incidents where that field has been populated, that the review report has been shared. Now, even though we share the review report, and as you know from our open disclosure policy, that means the process is completed. There might still be ongoing communication with the families and so forth, or the patient. But from a process perspective and a measurable piece, that's closed. But we know that can be not easy sometimes to close out in the real sense, really. Category 1 and Category 2 service user incidents awaiting open disclosure. So depending on the level of harm and the category of the incident, where we see that there's a blank or a no or a don't know in terms of that particular field, if open disclosure has happened. So that would be really important, because obviously you would want to track those incidents and make sure that that happens. Now the exemptions might apply, so it might be very reasonable that it didn't happen. And then also for the category 1 and category 2 incidents, where there are incidents where they are waiting on the open disclosure letter. Now, the open disclosure letter clearly only follows after the open disclosure conversation. So the open disclosure meeting or conversation must have happened for the requirement for the letter to go out. But again, that's a really important one for you to track as well. And then where the first couple of steps have been actioned and the review has progressed, just being able to confirm whether or not the incident report has been shared or is required to be shared. Now, in particular for the category 2 incidents, that might be relatively quick. People might have actually the findings and the learning quite early on. So that might be quite closed out much quicker than our more serious incidents. We do have a global view for notifiable incidents where people tick that it was notifiable incidents. Now, our own learning has been that there have been incidents where people have said it was a notifiable incident when really it wasn't a notifiable incident. And obviously, a lot of the organizations would be making that determination at the SIM meeting. I'm just going to click into there. I'll lose that. So yeah, so that 8F, I suppose, just take that with a caution, just because a staff member might have called it a notifiable incident, it might not actually be a notifiable incident. So the one that we generally rely on for reporting on notifiable incidents is 8H, because we can see that a notification has actually gone to the regulator. So the service has confirmed that it is a notifiable incident and has gone to the regulator. One of the other learnings that we had as well quite early on was that some services initially, I think when they were getting used to the functionality around the notifiable incidents, is that they had thought they had submitted a notification to the regulator, but it was still in draft form. So maybe the last function, the last button wasn't clicked or whatever. So it's quite helpful to just sometimes check if there are any notifications in your service in draft format, just to confirm, just to check whether or not that should have been submitted. So that functionality is there as well. So for anybody who's relatively new to NIMS, or in particular the reporting functionality, we have some very expert colleagues on our team in the NIMS side of the house, in particular Florina on our team. She's developed a very nice training video. This is the link that you can see for that training video, and it goes into a lot of detail around the NIMS functionalities, around building reports and that. So if anybody hasn't looked that up yet and has that as part of their role, I'd encourage you to look at it. You can see she has time stamped the video and will show you if there's particular function that you want to do, and certainly is a very helpful tool for learning purposes. Okay. So these are just a couple of the reports that we use. Now you can all build your own reports on NIMS. That functionality is there, and I'm just sharing this for shared learning purposes. So when we obviously started with the Patient Safety Act, one of the asks to us was just to keep an oversight of what's coming into NIMS to see whether there were any notifiable incidents that maybe should have been reported. And we would have engaged with a number of you throughout that time, just to query some of the incidents that were coming in, just because it was all very new. So this is one of the customized reports that we did as a very broad search term, which you can set up in your organization, or we can copy this view into your account if you so wish. Just email our team. So incident create date is not unassigned. Sorry for some of the technicality, but that basically means it is an actual incident. So it's not something that's been put on the system by the state claims agency. You know that they use the NIMS system for logging claims as well. So we particularly want to focus on our incidents that our staff are reported. And then we have a search in there for the particularly serious incidents, so where there's a category 1 incident reported and the outcome is major or extreme, or the additional outcome since the incident is death. So we know most of the notifiable incidents, the patient will have died. And then there's a particular cohort of notifiable incidents in the maternity services, whereby a baby went for cooling, or they had a HIE, they had an encephalopathy. So we added the search just to look at the SREs with a similar interpretation and not quite the same. And we would include those in the search where the summary of the incident contains cooling, or the summary of the incident contains therapeutic hypothermia. We would pull in that search any incidents where the notification was retracted, notification was in draft, or the notification was submitted. And that just gives us a kind of a comprehensive overview for that assurance piece, just to link in with services. The notification retracted. So I've talked about the notification to the regulator being in draft and notification being submitted, which is your confirmation. We did have originally a few incidents that were reported when we were just kind of getting familiar with the legislation, the Patient Safety Act, that actually on further review of the incident did not meet the legal criteria for reporting. So we do have a process whereby the service would then contact the regulator and confirm with them that actually this is not a notifiable incident. They would, and the service would contact the NIMS team then and highlight that, and we would have to contact the state claims agency to retract it, just to change one of those fields and call it retracted. So this is just a very broad search as well that we can copy onto your account. It just captures all kind of incidents involving a patient, because obviously open disclosure involves are for patient related incidents only. Now, the right thing to do, obviously, if it's a staff incident and one of our staff is harmed, that we're still open and transparent, but this process piece is only for patient safety incident. And we just do a generous search of service user incidents where there was a potential category 2 or category 1 incident, depending on the harm at the time of reporting or as an additional outcome. And that gives us all the incidents, and then we can apply the different filters. So that's for anyone who's familiar with setting up those reports, this will be relatively straightforward for them. When they do build the reports on NIMS, obviously there are a number of columns that they would use, or that they would try and capture in that report, which are then extracted onto the Excel spreadsheet that they then work from. And then just to go through some of the ones that are important for us. So for anybody who's working in NIMS, if you're building reports for your organization, these would be quite relevant around the open disclosure piece. Now, we have a lot of columns included. Generally, we find at national level, you might end up doing a report And then somebody asks a question, you haven't included that particular field. So we generally try and extract it all and then reduce it. So, some of the key ones, so these are your very standard ones talking about the details of the incident. We generally include a lot of location levels because there's very few of us in my team, but we do have national access. So we obviously see all the NIMS incidents that are on the system. So we really need to drill down what region is it. We're building the IHAs at the moment. So going forward, one of the regions have their IHAs established already, and we're working through the other regions, so they will be available soon as well. But we rely on all the locations, and you might not need that. You'll know what areas you have access for. But important for us is obviously the level of harm and the category of the incident to make sure that we know at what point the various steps apply. So these are the kind of headers for the fields for any open disclosure reports that we include. Is this a notifiable incident? The type of notifiable incident, the notifiable authority, and this importantly, patient safety notification status. So that will tell you whether or not the incident was submitted to the regulator, whether it's in draft or whether it's been retracted. If it's blank, then it's probably not a notifiable incident. And we've, across the HSE in a 1-year period, we've just reported over 100 notifiable incidents, and they'll be mostly in maternity services. So the high likelihood is that that field will be blank because it's not a notifiable incident out of the 200,000 that we report every year. Open disclosure plan, this is one of, and then patient safety notification date. Is important also because there is a legal requirement for the notifiable incident that we report them within 7 calendar days to the relevant regulator. So it's a very short time frame, but it is dependent on people, on our staff being confident that it was, or being satisfied is the language in the legislation, that it is a notifiable incident, and they generally make that determination at SIMT and so forth. Then the open disclosure plan, that's one of the fields on the form that goes to the regulator. But then for our purposes and our assurance and our measurement piece for the category 2, category 1 incidents and notifiable incidents, has open disclosure taken place? By that we mean, have they had the open disclosure meeting or the open disclosure conversation where they acknowledged it was the incident, apologized, and explained what the follow-up steps are? The date of the open disclosure is captured and opened up, and you can also capture the exemptions on NIMS. Open disclosure was not possible, and the reason for non-open disclosure, so which of the 2 exemptions apply. Then important from that measurement piece, has a letter been sent following open disclosure, the date the letter was sent up, and then finally the date review accepted by the commissioner we have in our report as well, because generally we would assume or understand that the commissioner approves the final review report, and that is then shared with the patient and the family. Okay, so these are kind of the important ones if you're building any of the notifiable incident, the open disclosure reports for your organization. And then these are all the other pieces of information that we generally include as well, but for your reports probably be removed or extracted. So this is just, so we've included this in the slide, and I'll just take you through the NIMS system now. Just by way of example, it's just a nice little filter for us, and all of you who are much more experienced and better versed in Excel than myself will probably have a lot more skill sets around manipulating the Excel spreadsheet there. But as I said earlier, when you go into the NIMS system, you go on your little square here in the corner, you pick Incident Manager. This is where you access your page. You might have a particular NIMS number you want to look up. You go into the filter function over here and then put in your particular NIMS number, apply, and then search for that. Now, I did explain that this was the test center. So one of the things I realized quite quickly yesterday was that the test center does not have all the global views copied on it. So these are the current global views on the test center, and you'll be familiar with those. They are generally available on all of the actual NIMS system as well. But when you scroll down on the test center, it ends at 7. And you'll know from the actual NIMS system, there are all those new open disclosure global views now that come after 7. So just to demonstrate a global view for anybody, I'm assuming most of you will know what it means, but you might want to see all incidents that occurred in your organization in the past 7 days. This is a test center, so nobody's obviously been reporting any over the last 7 days. We won't have that. We won't have that result if we logged on our actual system. This is another global view, all extreme incidents that occurred year to date, and all of these, they're all fictitious incidents are coming up there. Now, what I did yesterday, I just built one of the reports that I highlighted to you on the system. So open disclosure, notifiable, any category 1 and category 2 incidents. And we get this search. And there are some incidents populated, and obviously you can edit the date range. So I might just pick it for the Q1 of this year. Oh, 25 to 2103. There you go. And then you can export all of those incidents into your Excel. And then you have your Excel file there, okay? Now I did this yesterday already, so I'm just going to open up the that's essentially the same Excel file. So this is your very large document with all the different headers. So it'll be within your gift and decision making how you want to edit that down, what columns you feel you need. Because it's a test center, you can see people just populated it with summary, but this would be the actual summary of the incident. So you can work with that and decide what you want to use. For us, I'll just scroll across. These are the important open disclosure fields that I touched on earlier. So in particular here, you see the patient safety notification status. So you want to see all the incidents where notification was submitted. And then you have your 3. It explains what the incidents were, who they were reported to, when they were reported, and has more information around that. Okay. Let's see if there are any in draft that you maybe want to check in your service. Notification and draft. There you are, okay. So the type of notification, who was notified and when, open disclosure plan. Not the most important one, like some services might have completed it, but it's very specific to the notifiable incidents. But importantly for all our reports that you should have on there, if you're preparing reports for your organization for category 1, category 2 incidents, it's this field that has open disclosure taken place. Yes, they're the ones who'd be happy, confirm and be assured that they would have been completed, and then importantly, you would check all of these should have been followed up with in writing if they're category 2 and category 1 incidents, which was my search criteria. You see only one has a letter sent at this stage, and the date the letter was sent. Okay. see that with all of these, there weren't any exemptions that the team recorded or that applied at the time, so they should all be followed up. Okay, so they're the kind of important ones, and obviously any of the other ones where there hasn't been any open disclosure recorded, they also require follow-up. Okay. So it's the has open disclosure taken place? Did any of the exemptions apply that should be captured in your reports? Has a letter gone out? Dates is helpful, and has the incident review been shared? Now, although a lot of us certainly gave a lot of feedback, the date for the letter is important for the notifiable incidents in particular, because the legislation requires us that if we have the open disclosure meeting and conversation, that the letter should follow within 5 calendar days. So when I do the quarterly reporting to the Audit and Risk Committee, because our senior leadership team of the HSE asked for assurances around open disclosure, we focused in on the Patient Safety Act initially because we need to get that 100% right. And maybe it will expand in the future, but for now we're honing in on the Patient Safety Act. So I always have to see when people say they've done open disclosure, what date that open disclosure was at, and when did the letter go out, and was it within that 5-day calendar timeframe? And I completely understand the challenges with that. That can be difficult for services, and we've fed that back to the department. There's a slight caveat with that legislation that they're meant to review it again in September of next year. So even though having all of this data, whether we're managing to meet that requirement or not, will be helpful for us to highlight with them. For all other incidents, it's important that we follow it up in writing, but there's no time frame linked with it. Okay. And then you have your other fields, which are quite significant. So this is just a general filtering that we do, or you can do if you want to be a little bit quicker about it. So, you know, when you have your pivot information, you just, oh, I haven't got it on the full page now, but anyway, I've done the pivot here. I've set it up like you can see over here, and I've included that in the slide. So obviously you have your records in the values field, so it counts all the different incidents. I want to see how it applies for the different types of incidents, and I might unfilter all of those just to show it to you. I have the filters here. So in the for that quarter, there are 431 incidents. 417 are recorded as moderate, and 14 are extreme. I have a filter. I want to see if they are a notifiable incident. Yes, there are 3 of them. Obviously, this isn't quite accurate, although it might be moderate harm if it's a maternity one. I want to see if there are any where there hasn't been open disclosure yet, and then I can click into that one record and get more insight around it. As I said already, this is a fictional incident, so I can see whether or not one of the exemptions applied with regards to that or not, or whether it requires follow-up. And then we can also see where the open disclosure has happened, if a letter still needs to go out. So we can see there's one incident where the letter needs to go out. Okay. So I'm sure you'll all get very familiar and will build all your own reports around that. We can copy some of those views, as I said, for you. But this is just how we've been working it and looking at the NIMS system in terms of the data. And that concludes today's session, but we're very happy to take some questions as well. And we're also very happy to engage with you one-to-one if that's any help, if you would like us to do that.